the whole construct of a health moonshot is really to inspire the world about what challenge are we solving? How big and bold can we go? And that's really the dream of a health moonshot.
Okay, so we're going to talk to Unity Stokes, co-founder and president of Startup Health, about 2024 at Startup Health. What's new? What should people be looking for?
Well, I'll tell you, we are really expanding all of our health moonshot communities. We have 14 global health moonshots, and we're building out all the communities. We're inviting startups, founders, CEOs from really the world's leading, innovating, early stage companies to join these health moonshot communities, and we're just opening them up to members from all over the world.
Give us some examples of what some of the verticals are you're focusing on.
So for the past couple of years, we've really leaned in heavily on, for example, type 1 diabetes and our type 1 diabetes moonshot with the Helmsley Charitable Trust and about 30 amazing startups. We're doing an Alzheimer's moonshot with Gates Ventures and ADDF and about 40 extraordinary brain health companies doing neuroscience, neurotech. We have a cardiometabolic moonshot, a women's health moonshot. We've got a longevity moonshot, a children's health moonshot. We're doing a maternal health moonshot. There's really lots of very, very specific themes that are all critical to health and well-being. And we're just focusing on each one, building out those networks, and most importantly, building founder communities so we can solve these big challenges together and not do it alone.
Okay, so when you say founder community, how does that differ from, there's accelerator programs out there, there's early stage investors who might have support systems, but how is this unique?
At Startup Health, our Health Moonshot communities are unique because, first of all, we're founder-centric, we're CEO-centric, we're really there to support those innovators that are the builders, the makers, the creators, the ones really driving the innovation. And what we do is we think very long-term. What do these communities need week after week, month after month, quarter after quarter as they scale? Getting customers, getting investors, building your teams, but doing it together as a community as opposed to going it alone.
Why does that matter? And have you seen it play out, this sort of peer-to-peer power?
Building startups is such a lonely journey at times. It's really hard. And to do it with others who have gone through the struggles, the ups and downs, can be the difference. It can really make the difference between how you navigate those ups and downs.
I just talked to somebody today who was interested in joining Startup Health. I listed out all the things that we do, and they said the number one thing we're looking for is peer support, because we don't know anyone else who's doing what we're doing. And I said, that's what we got.
Peer support, community, doing it together as a collaborative force, I think is significant. I think the other thing that's really important is to learn from each other, but also the storytelling. The whole construct of a health moonshot is really to inspire the world about what challenge are we solving? How big and bold can we go? And that's really the dream of a health moonshot. So if we can think bigger, if we can dream bigger, and if we can really push the boundaries of the possible, I think that's a big opportunity. But to make that real, you've got to tell a narrative story that people understand, that they'll be inspired by. And I think that's why we do magazines and podcasts and newsletters and trying to tell these stories so that the people of the world, like my mom, can understand the extraordinary science and technology and innovation that's being built by these amazing health transformers, and educate the world about the progress that's being made, because truly it's very inspiring.
What kind of founders are you looking for a Health Moonshot community? Who would be an ideal member?
We are looking for batteries included founders, people that are willing to be part of a collaborative effort, lean in, supporting each other and those around, mission-aligned founders. What mission are you on? Are you passionately working to solve a big challenge and organizing around those themes we talked about, Alzheimer's, cardiometabolic, diabetes, women's health, etc. And so when you have a mission, when you're inspired by something big, you really, you never quit.
Yeah.
You find a way to solve the challenge.
Stage agnostic.
All stages, we have 2 people in a lab or a garage, all the way to companies with thousands of employees who have raised hundreds of millions of dollars. So we're really supporting founders of all stages, early, mid-sized, late-stage companies. Really what matters most is that mission alignment and the batteries included nature of really the spirit of the entrepreneur and what they care about.
I know Startup Health has been around for many years, and yet there is sort of a new spin, and we're launching something kind of special at this event. What's the reception been like?
It's been tremendous because we cut a lot of the friction out. It's a member community, so anyone who meets our criteria, which you can read on our website, it's just a monthly membership fee, and it's just way easier. So I think we've gotten a lot of good feedback about just making it easier, opening those communities up so companies of all stages, including later stage companies, can join these Health Moonshots.
Yeah, that makes a lot of sense. The folks I've explained it to have just nodded along and said, I get it. It just makes sense. Last words for a potential funder who's curious?
Last words for a potential funder who's curious. Well, what I would say is just connect with us. What moonshot matters to you? What moonshot are you trying to solve? Let's do it with the global army of health transformers. Let's speed up the innovation by doing it collaboratively. I think everyone has a part of solving a moonshot, from the stakeholders to the startups to the funders. The whole ecosystem matters when you're doing something bold like trying to solve a health moonshot. So give us a call. Let's figure it out together.
I love it. All right. You heard it here.